Hello. The peer-reviewed journal that I will be discussing today is titled Decomposing the Gap in Satisfaction with Provider Communication Between English and Spanish-Speaking Hispanic Patients by Jennifer Villani and Caroline Mortensen, which I obtained from the West Texas Research Database. The article is from the Journal of Immigrant and Minority Health. This article discusses communication barriers between Hispanic patients and healthcare providers. In the healthcare field, compared to whites and blacks, Hispanics have reported to having a lower satisfaction in communication with their healthcare provider, which according to the article may be due to their level of acculturation or patient-provider concordance based on their ability to speak the English language. To further study this healthcare communication issue, a study was conducted. The data used for the study was derived from the MEPS survey, which included an oversampling of Hispanic, Black, Asian, and low-income populations, and it was divided into two based on their ability to speak English or not. The communication satisfaction with providers was based on 4 questions on the survey, which asked the surveyed patient to recall recent visits within the last 12 months. The main independent variables in the study were acculturation and concordance, which was measured by a scale amongst the surveyed group. Out of the 16,243 Hispanics who completed the survey, 13,985 were excluded participants due to them either being coded as inapplicable or due to insufficient data or unresponsiveness. It was found that Hispanics who scored low on the acculturation scale were mostly Spanish-speaking, and those who score high were mostly English-speaking Hispanics. Although there were found to be no differences regarding patient-provider, racial, or gender concordance between the Spanish-speaking Hispanics and the English-speaking Hispanics, the English-speaking group had a higher language concordance with their providers than the Spanish-speaking group. The results demonstrated that English-speaking Hispanics reported higher satisfaction with provider communication compared to the Spanish-speaking group. Health insurance was found to be the largest factor for high satisfaction. The Spanish-speaking Hispanics had a higher rate of uninsured and publicly insured survey respondents compared to the English-speaking Hispanics. The other 2 predictors of provider satisfaction also included education level and acculturation level. In conclusion, the article found that the greatest contributors to provider communication satisfaction were acculturation, education, and health insurance type. Acculturation was found to be an indicator of satisfaction. A point brought up by the article was that in the Hispanic culture, more time is spent with providers in their native country, and due to the same expectation in the new country, the level of satisfaction lowers since this need is not met. Education level of the patient plays an important role in patient satisfaction, and according to the article, providers usually adjust their communication style based on the patient's educational level. I feel like any peer-reviewed journal, there was some strengths and opportunities for improvement. I felt that the survey group for the data was weak and not a proper representation of the Hispanic population. It was indicated that the majority of the population was excluded from the survey due to limited information provided, and the majority of those included in the survey were mainly female. Another opportunity for improvement was the effect of interpretation services and how it impacted patient satisfaction, as this data was not distinguished from patients who spoke the same language as a provider and those patients who used an interpreter. A strength that this article demonstrated was the ability to not just look at language alone as a communication barrier, but other socioeconomic barriers such as education and health insurance along with the language. Another strength identified in the study was the calculation for acculturation scale used. The MEPS variables used to calculate acculturation were the language used to complete the survey, the language spoken at home, and the proportion of life spent in the US. This showed strength because it did not just base acculturation based on a set of questions, it was a measured variable that demonstrated the patient's acculturation effectively. The questions I would ask from you are, how would you gather a better representation of the Hispanic group to participate in a survey like this again? What other socioeconomic factors could be used in the survey along with the language to gauge provider communication satisfaction? What other strengths would you identify within the study completed? Do you feel that a survey tailored specifically to this topic rather than the one used in the study would have provided a better understanding to this healthcare communication issue? Why or why not? And if you have the resources to do this study again, how would you incorporate interpretation service in the data to include more individuals? Thank you.